Thank you so much. We're very excited to be here. This is a great opportunity to kind of share our journey with everybody. I'm Grace Chen, the CEO of LucidAct Health. We are a San Francisco, California-based early stage company. We started doing remote patient monitoring about 18 months ago. So far, we have close to 3,000 patients, Medicare, 100% Medicare patients, about 70% of Medicaid patients on our remote patient monitoring platform. So today, I really want to kind of share with you our solution, as well as a lot of lessons learned and the journey we have taken. First of all, I really want to share remote patient monitoring industry, like the physicians have just shared, is really at an inflection point. The experience we have had so far for the past, maybe 2 years is there's mixed results. What we have learned is that a lot of the remote patient monitoring solution is very much device centric. There are so many medical devices with fancy interfaces out there. And there is a missing link between the patients and the providers. A lot of times the data are typically just trapped or stuck in the patient's phone. There is no direct link for the physicians to quickly take a look at the data and take actions if something goes wrong. And also, this is the current remote patient monitoring solutions where program is not really part of the provider's workflow. Just like Dr. Egger said, how to get those data into the existing EHR is a huge challenge. So Lucidec came out, our remote patient monitoring from day one when we designed the solution. Our focus is to make the patient experience, patient onboarding extremely simple. Also for the provider side, we want to make the provider's experience a lot simpler and make their ROI, how to they make the reimbursement from Medicare work for the providers, how to make the operation easier and not have to hire a lot of new people just to manage the program, and basically make the ROI works. The last piece is really, there are so many more devices coming to the market, and they're more innovative, much smaller size. How to introduce them to the providers in a much easier way than creating different remote patient monitoring process with different companies. And then also, patients want to have their own blood pressure devices. What are you going to do with that? So I would like to kind of quickly go over our solution from the patient's perspective. We have 5 different devices, from blood pressure and thermometer. They're all Bluetooth enabled. Very special part of our hardware devices, we designed and deployed a gateway hub. This hub has a 4G LTE network enabled already, chip inside. It can automatically communicate with all the devices through Bluetooth and send the data to LucidAct cloud through basically cellular network. The other part of this, that you can see the box, this is kind of our generation box. It's pretty bulky, but we purposely designed that way with big buttons. With big emergency buttons that patients, it can serve as a PERS call center, PERS services. We provide 24/7 personal emergency response services. This box can also talk back to the patients after they take their blood pressure and say, hey, your blood pressure is this, and is activated. The language, we can customize this box to speak in multiple languages, from English, Spanish, Chinese, and Korean. So that's very much customizable. We recently get into a contract with a medical center who is serving the biggest Chinese population in Northern California. So this language customizable capability is very important for them. So that's kind of, Dr. Egger just mentioned a moment ago, like how can we move transition from analog to a more digitized way, and then we put a lot of efforts in this. I first tested out this device with my mother, who is many dual eligible patient, who is very much non-tech savvy, but she knows how to use a blood pressure, measuring my dad's blood pressure for years. So, and then when I got her approval, I know this is a good solution for many of the non-tech senior patients. And from there, our second kind of part of our service is we offer a remote call center staffed with certified nurses and pharmacists. So this is more of a distributed, remote team who can help kind of be the insular layer between the massive amount of vital data from patients' home to the provider side. There are a lot of, we send, at the very beginning, we send a lot of alerts, and we need a kind of a intermediate layer to filter the alerts and get symptom checked out before escalating to the physician side. So that's kind of the second part we are offering. The third piece is really the cloud-based care management platform that can retrieve the data from our hub. Just like the doctor mentioned a moment ago, we got so much data, especially from EMR as well. We're part of the Commonwealth Health Alliance HIE. So we can merge the patient's health history, medication, diagnosis, allergies, and with the conversation that the nurses took, tons of data coming in. We have created a kind of AI algorithm just to indexing and categorize the patients based on the frequency of the vital data or alerts, as well as whether the data is out of range or not. So what we have done is we categorize those patients based on 16 different categories of their social determinants of health need. So this area, I have to say, we have started. There's still so much work to be done. Right now, we can create a very effective a patient outreach list for the nurses to outreach more effectively than just responding to out of range alerts. And this just passed during the summer. We created a conversational bot by providing resources. So if patients has issues with housing, COVID testing, food banks are in their neighborhood, in their local resources, we can use the bot to respond to that. So far, we have created that database for California only. So at the moment, we are working with about 46 clinics, close to 3,000 patients. We have observed about 18 to 30% of our patients ended up triaging to the providers, potentially prevented unnecessary hospitalization. So I really want to share one of our patients' testimonial is that they said they have their blood pressure for years, but they want to only use LucidAct blood pressure cuff when they're not feeling well, because there is a nurse will be monitor the data and might call them afterwards. So you can see this is a lot of change management involved. Patients have their own devices. How would the new RPM solutions help them? So we really believe, the future is the home. There is hospital at home, primary care will be at home. Many of the healthcare services will be provided at home, though. So we all started with taking vitals from home. So we really believe this is a huge opportunity in front of us, and we really need to figure out how to make it work both financially and operationally. And technology is not the kind of the only solution. So this is our conversation. If this is our contact information, if you'd like to talk more with us and see a demo, start a trial, we would be very happy to talk with you. Thank you.